I think the magical formula is easy. We want to that every patient to feel respect, understood, and care for their own language. We built our own clinic management software. It's a 360 clinic management for more than 4 years now. We built this software for provide better experience to the patient. In the end, we use a telemedicine, we use a digital record, but it's something important because the technology never replaced the human touch.
Welcome to the C-Suite Power Play, where leaders break down the decisions behind their growth. Today, we are entering into the healthcare industry, an industry where trust, community, and culture play a vital role. I am Ruth Villalonga, and this is my co-host.
Hi, I'm Jason Gonzalez. We're really excited that everybody gets to listen from our guest today, Olber Reyes, who is the CEO of Clínica Familiar La Virgen de Guadalupe. It's incredible to know the story, to how much you've grown in such a little bit of time. We're really excited to learn, especially with this complex industry, that a lot of folks have the vision, but they don't know where to start. And we're here to learn about you. Thank you for joining us today.
Yeah, thank you for the invitation. It is an honor to be here. Yes, Clínica La Virgen de Guadalupe is our mission is simple. To bring quality healthcare for all Hispanic families.
And let's set the stage here. So, Olber, you are from Cuba and came to the U.S. by ways of Venezuela, my home country. A trained physician, you set up Clínicas Guadalupe to serve the community, a community that often finds themselves underserved and a little left behind by the healthcare system. And today, they have 17 locations across the Dallas-Fort Worth area.
In less than 10 years.
In less than 10 years. And, you know, a $15 million revenue in an industry where high costs are always a deal breaker. So we are excited to be here with you today. And, you know, the first question is, you know, running this institution is not a small feat. What makes leading this type of clinics different from a mainstream or general market hospital or healthcare center?
Yeah, managing a clinic is different than managing the hospital because we focus on on people, not just the patient. We want to provide the best experience for all the patient that we already have and the patient that never know about us. Yeah, it's different. We focus and provide primary care, family medicine. I come from Cuba. And in Cuba, the first medicine that you know is about prevention. And we want to provide this medicine here. And the healthcare system is a little bit different in USA. But in the end of the day, all patients is the same. All patients have the same problems, you know, about or the same
needs, I guess.
Yeah, correct. And yeah, this is the difference between one clinic or one primary care clinic and some hospital or another more big medical centers or just like.
I find this fascinating. So before the podcast, I was sharing my doctor is a concierge doctor and he started his own practice. I'm curious because he's learning some of the key things that you already found the formula to. You talk about the experience. You talk about the need there. You just opened up the 17th location. Congratulations. In Louisville, Texas. So you're all across Dallas-Fort Worth. So what's that magical formula? What brings that success?
Oh, it's a good question. But I think the magical formula is easy. We want to that every patient to feel respect, understood, and care for their own language. Because it's difficult when you visit the doctor explain you the same in your same language. It's difficult for you to stand, But when you visit the doctor, if the doctors and you speak Spanish and the doctor speak English, another language, or it's more difficult. But we want to provide this facility, this magic formula. Is all of this together, like understood, simple, and in the same language.
What I'm hearing is super powerful, and is he found a missing part in the puzzle of the healthcare market in Dallas-Fort Worth. With a 46% Hispanic population, yes, having been in healthcare myself for many years, I know how important language and culture play a role for the patient. Yeah. It really is key to build trust, to feel understood and cared for. And it's that, key element what really opens accessibility. So I think that it is a treasure, really, what he has found, because he found that there was a need and he came to fulfill it. And now we are seeing you scale. So for our viewers, I think that is something that we have discussed, in the past, is find a need, find a problem, and try to solve it. Make sure you know what your total addressable market is and put your vision there. So great lessons. So one insight that you can share with us about how you have built trust in the community. Can you walk us, because even if you speak the language and you are embedded in the culture, how do you turn that patient in?
Yeah, it's speaking Spanish is one of our value, one of our value. But the language is build trust. And we can to connect better with the community if they trust to us, because we know about the histories, we know about the fears, and their hopes too, And yeah, this is a way that we connect with the community. We want to provide a good experience, because in the end of the day, you visit some clinic, you pay for your services, and you need help. If not, you don't need to visit the doctor, but you visit the doctor because you have something or that you need help. And when you pay all of this, for example, you make your appointment, you stay with the nurse and then with the doctor, and then you come from the pharmacy and pick up your medication. That's it, and you pay. But in the end of the day, we want to provide some big experience in all of this process, because, for example, in our clinics, our walls is green walls. It's different, because we want to connect the feelings too, Is making sense?
Yes, of course. And you know what? I mean, and JC can tell you, but in my husband's clinic, we also are providing an experience.
Yeah,
yes. There is a value to presenting the service in a different way that makes it more palatable. It's already difficult to go to the doctor, right? It's already...
Yeah.
And to have the opportunity to provide that experience in a different way.
Correct. That make our clinic part of the community, not just another medical office, And this is our formula and our secret is provide this, receive our patient. Hey, thank you for choice us. No worry, we take care of your help. Our doctors explain. Sometimes you need to explain more than 5 or 6 times, but doesn't matter. This is the point,
Dr. Reyes, what I hear you say is, and I think this goes for every industry, it's you adapt to your client's needs. And it's not the other way. It's not saying, you know what, this is how I do business and they have to adapt to me. No, you stood out.
Correct.
That experience is incredible. Now, to deliver a great experience to your patients, my next question is around staffing. How do you find the right talent? How do you retain the talent? Because something that I see with all my business clients is it's hard to find good people.
Yeah, we create some programs. All of this is about the training. We have our own online university for our people, our employees, and in this university we make a couples like a course, customer services, customer experience. It's a information relationship with your role in the clinic, from the nurses, mid levels, doctors. Yeah, with all of this, we create some corporative culture inside our corporation. You mentioned before that Clínica La Virgen de Guadalupe is a lot of clinics, more than 16, but 17, sorry. But in the end, we have some main corporation, it's Noble Medical Group. We management all Clínicas Guadalupe, but we management 43 clinics more. And we provide all of this service. And we have a different departments, including human resource, IT, marketing, all of this. But when somebody need to know or want information about us, they come for our office. It's pretty near, almost neighbor. But they come and they saw all of this structure, because we have a big structure. I think is that behind some CEO or some structure is a good team. The team is the secret here for hire people, for capture all this attention, for make better, make the thing better every day. And all this.
I mean, what I'm hearing is they don't only have the clinics, they also have another line of business, providing infrastructure and training for a number of other clinics.
Correct.
And what I heard loud and clear, which I am a firm believer on, because that is part of also of my work normally, is internal culture. The culture is everything. I heard you loud and clear when you talked about the courses and the training you give your staff so that they know, and you said it very clearly, their role. Because everybody plays a part in the successful experience of each patient.
It's great.
And I think that is something that you can extrapolate to almost any business, right? You need to bring on board your team with the mission and understand their role and help them understand the role so that they feel a valuable piece of that equation. And talking about that, one thing that often competes with that culture because it disrupts it is technology.
Yeah.
So what can you tell us about innovation in healthcare, right? I mean, telehealth adoption, yes, no. Have you thought about it? Are you incorporating that? Tell us a little bit more about innovation.
Okay, yeah. We have the innovation is part of our key, and we use telemedicine for more than 10 years now. And we have some infrastructure in the clinics with the telemedicine cars and all of this. And we have digital records too. We use a couple software. Actually, we use EasyW, eClinical Works. Is some software that we management all records. But we built our own clinic management software. It's a 360 clinic management for more than 4 years now. We built this software for provide better experience to the patient. For example, if some patient visit us and we want to, it's their birthday, for example, the system automatically send happy birthday, we stay here for you, or if we want to send some gift like a cookie, doesn't matter, we use this. But in the end, we use a telemedicine, we use a digital record, but it's something important because the technology never replaces the human touch. We use innovation to make the experience more warmer, but faster check-in, reduce the time in the clinic, etc. But the patient want to talk with somebody, not the machine. With the doctor need to talk with the patient, need to touch the patient, examination, physical examination. And the technology is important. We try to innovate or implement every time something new, but we don't want to lose our
Human touch.
Okay. Yeah.
I love that. So, doctor, something I keep hearing, and I applaud you for it, is you keep finding these opportunities, these gaps, and you're doing something about it. You mentioned how the clinic was founded. But you're also mentioning some of the opportunities or areas that you could do things better. My question around this topic is, where do you find the time to be so hands-on? As an entrepreneur, as a family man, you're juggling a lot. How do you prioritize it? How do you stay sane?
Yeah. Okay. This question is a pretty common question for some people under my circle. But it's I use some task management software. It's a Notion. Is the name.
I use Motion.
And we classify our task, like urgent, but urgent, not urgent. We use some metric for classify everything. We use artificial intelligence for read the emails, all of this, and we try to focus in the day three important things. So only three, in one day. In the question, and the end of the day, the question is something that I make today is something like a follow our main goal in the year. If yes or not. If not, I need to focus. I need to make more focus.
Yeah.
If yes, we're good. This is the way that I try to separate my or have time for everything. We have a couples diagnostic centers too. With ultrasound, X-ray, etc.
Okay, what do these guys don't have?
Hospital. We don't have a
Just
hospital
yet.
yet.
Just yet. We almost closed the deal.
Yeah. This is some big goal for the next year. We or make some task, for the day. Every day, we planning the month, we planning the year.
So you have a lot going on. And before
Go ahead.
I want to ask you a question. I view you as someone very successful and what many of us could look up to. But I'm curious, how do you define this success? What is success to you?
For me, the success for me is I have a 2 child. Some boy he have 4 years old, and my daughter have 9 years old. The successful for me is when I stay here, when I don't exist, I can to provide something for my family, for
Generational wealth.
Yeah. This is that I wake up all day in the morning on my bed. This is the idea that I have every day for 10 years.
And I as a Venezuelan asylum seeker, 22 years later, I can totally relate. I'm married to an asylum seeker from Iraq, Baghdad, and that's what keeps us moving, right? To provide. the safety net we did not have. So it's a very common aspect in the immigrant experience. And for many of us who have not necessarily been born in wealth and we want to leave our children in a better place. Coming back to what you were saying, a lot of the generational wealth is built on a couple of things you mentioned that we have heard time and again. Most of the successful CEOs that we have interviewed sort of highlight, which is planning, and then vision, which you explain it in the most practical way possible. Have 3 things every day, and at the end of the day, check that you have accomplished at least one, and how does that fit into the vision? Not into today's task list, not into tomorrow's like hot fire, right? How does it fit into the vision? And I think there's something incredibly powerful about having that vision as your North Star. Because I often talk about how the CEO from 20 years from now should be the one making the decisions today, because he's the one who's going to live with those. So as we talk about that, what advice would you give to other CEOs, perhaps in the healthcare industry or other industries, who are trying to scale, trying to grow beyond that, hurdle of the $1 million, people that are really want to take their business to the next level?
Okay, you need to focus in the metric, track the metric. And for example, in our case, the most important metric is customer satisfaction. The customer satisfaction is the only metric that I check every day, every Monday, and it's because with the customer satisfaction you can to check the customer effort. You can to check customer experience, and you can to check a net promoter score too. What probably if your customer or your patient refer your services to friends or family, you're good. It's not, you have a big problem. And another thing is how many patients we see in the clinic every day. It's a volume patient per day.
Sorry, because I know the industry somewhat, and there is something very, very challenging. We think, referrals are super important, customer experience, top priority. How do you get new patients? Because that is typically the biggest hurdle.
The new patient, actually, the 90% of our new patient coming from referral.
Wow.
If you provide a good experience, you have a new patient. Because one patient, I think one clinic start with one patient. You see one patient, you provide a good experience, and this patient coming back with another. If you provide not good experience, you provide bad experience, this patient go or which patient come talk to 7 more. They never come to you. But yeah, the referral is a key for a new patient.
How many patients do you currently have with the 17 clinics?
The last year we saw 85,000. The last year,
85,000 patients.
Yes.
Oh
yes.
my God.
Just one clinic here in the Dallas in Frankfurt. We have a some clinic. Too many Venezuela patients come. We saw 170 patients by day.
Wow.
Just one clinic.
And the overhead that it takes to sustain that operation, from the provider perspective, from the supply perspective, from the, it's incredible.
So less than 10 years, because 2016, right? You started in 2016. 17 clinics as of a couple of weeks ago. You had the Louisville. 85,000 patients last year. How big is your staff? How many employees do you currently have?
We have a 250.
250 employees.
At the moment, yeah.
And still growing.
Yeah, it's still growing.
That's incredible.
And that is not counting the people he's training for other business owners in the healthcare sector, because
Correct.
you're training all these other staff people from other business.
Yeah, actually, we create the first Hispanic Clinic Association, the American Hispanic Clinic Association, because our idea with this is non-profit organization. Our idea is provide information, legal information, accounting, operation, all of this experience for the new CEO, for the new entrepreneur guys. Yeah, we want to connect all of this.
Unlike Coca-Cola, who keeps that formula a secret, right? You're sharing that to impact other businesses, and that's
yeah, we want to share that. Yeah, because I don't want that the people that start with the business, they make the same error, the same mistake than me. Legal mistake. I come from Cuba, and in Cuba it's different. The law everything is different. But when you arrive here, you need to know. It's mandatory that the rest of people, nobody care if you hire a good lawyer or not. But in the end of the day, you need to hire the best lawyer, because the money that you spend today is the same money that you save tomorrow.
True.
Something stands out with every person, every leader that would come out. They're very vulnerable, which takes a lot of courage, but they want to mentor others so they don't make the same mistake.
Yes.
Correct.
And I feel that, after this, we got to schedule some dinner, because there's a lot here that I want me and my husband to learn from, and you don't know this, but I have an extensive experience in managed care.
Oh.
I did Medicaid and Medicare for many years, both in New York and in Texas. So I know the difficulties of the provider network, reimbursements, P4Q, which are pair for performance under the Medicaid and Medicare structure. So I know the unique financial challenges of a healthcare operation. I know PPOs very well. I also work for them, which are, provider pay organizations, the private insurance. I want you to talk to us about some of the financial challenges that you have faced and what you have figured out. Like, how do you make it work?
The financial challenge, okay. We're trying to planning everything, including, for example, our operation meetings. They need to come in with our budget for every month, and we planning. Okay, how many patients we need for cover this budget, for pay all of this salary, and for take it a little revenue too.
Yeah.
And our focus is in the planning. If you're planning, you're good with all of this. Sometimes the insurance wait for pay you 3 months, 4 months.
Yes.
But we work. We have some mixed system, because we have a lot of patient self-pay too, and with the self-pay, we take care of all of this operation, running the operation. And with the patient with insurance, actually, at the moment, we don't accept Medicare or Medicaid. We only work with the marketplace insurance. But sometimes they it's delayed to the pay you, etc. But we continue running the operation with the self-pay patient, with this mixed process.
So you have a mixed string of income sustaining the operation.
Correct.
While you're still waiting to be paid out, because some of those will take a lot of time.
Correct.
And that's through planning will allow you to weather that storm.
Mm-hmm.
And Doctor, talking about planning, everyone has their little, I call them the board of directors, right? Your network.
Correct.
Who's part of your network that you rely on?
And the board of director or the network?
Or your network, right? I call my personal board of directors, right? So people who I need. So my spouse and I, we have a business, and we have our insurance as part of it. We have other folks. Who's part of your network that you reach out to that really help you guide all the planning sessions?
Okay, it's an interesting question. We have in the network, so we have lawyers, we have accounting, we have a couples clinics owners too. It's part, and yeah, we have a big structure with managers. All of these guys is part of the network. It's part of the board of director.
Yeah.
And yeah, if I have some brilliant idea, if they don't like it, is yeah, we need to create another idea or make it better.
And I have a question because you've been very honest with us today and very vulnerable, which we appreciate. And in the prepping part of the meeting of the podcast, you talked about like a partner deal that didn't go well. But outside of that, one question that we like to ask leaders is, what is that one mistake that you won't repeat again?
Is
That you make
Romy.
and you won't repeat.
Okay, is growing too fast without any structure. Create a clinic without structure. Create a clinic without planning. Because yeah, the growing of the business is not more bigger company or more size or more clinic. It's a like a balance or
Mhm.
between good structure for keeping the
growth.
keeping the growth, but for continue provide good services.
Yep.
If you have a structure, you have the employee, you have all this, you have planning, you can to continue provide the same services that with good value. But if not, it's a big mistake.
If you don't mind sharing, because I feel it's pretty deep, right? Can you talk about that mistake? You said, what were some of the key learnings? What was the situation, and how did you overcome it?
With
Growing too fast.
Growing
Yeah.
too fast?
What do you mean? Tell us the
Okay.
story.
Okay, our for medical office is we're doing about 3 years for obtain any profit. 3 years we lose money, and this is it's a big problem for with the company. But the another things, the most important thing is relationship with the employee. If you not take care of the employee, if the employee don't feel support for the company, they no provide the good service, the good experience. If you create some system that the employee feel support by the company, they provide this experience better than your vision.
Yeah.
Because I have some vision, but I stay in my office. In the end, the question is how I can share my vision with our 250 employee, because I want everybody saying the same. It's or provide the same experience.
And that,
Better.
That is culture. And I wanted to give you a standing ovation when you say growing too fast without the infrastructure and without the structure, because I myself, for example, was director of communications reporting to the CEO at a managed care organization when we were hit by Hurricane Sandy. Thank goodness we had a crisis plan.
Mm-hmm.
We knew exactly what we were going to do, who was going to do what, where we were going to gather, how we were going to communicate to our patients and our members, because it was an insurance, how we were going to communicate with providers. I mean, planning and having infrastructure is so important, because when you grow, your problems tend to grow. And they will be bigger, more serious problems. So I think that and then sharing the vision, that is really what makes a business replicable, right? And being able to scale, because everybody is a little piece of that vision that is walking, breathing, and living that vision every day.
Correct. Yeah. This is the secret.
I love it. You talk about staff, you talk about employees. something's been proven and proven again is happy employees make happy customers.
Yeah. I believe success in healthcare is not about size; it's about impact. Our goal is to keep growing responsibility, stay close to our community, stay close to our patient, stay close to our family, continue with the trust, because in the end, this business, the clinics, the healthcare clinics, is a trust business.
Yes.
It's different, like another business, that you can sell some clothes or whatever. But you need to trust first for visit the doctor, for visit the clinic. If you don't trust, if you don't see the impact in this clinic in the community, or the review, or for example, we participate in a lot community programs and community events, and all these people in the community see that we do, and they send curriculum, okay, I am nurse and I want to work with you, this is the way, or come with us, okay, I have a problem, I feel sick, I need your help, and we stay here.
I love that.
What an incredible, you have shared with us so much about community, impact, staff, and corporate culture, but also about keeping the operations running in a way that is structured and disciplined in order to sort of make everybody in that equation happy, right? Employees, patients, clinical nurse, everybody else.
And having a purpose is what I heard you say quite a bit. Is that impact, that purpose in life.
Yes, and we have one more question. We've been running through the lightning round without actually acknowledging it, but one question that come up now is, what do you think is going to be the next healthcare innovation in the next 12 months? For you or for the system, for the industry?
The AI in the system. For example, we implement the AI in our customer experience department, and when you call to the clinics, the AI, you feel human, but it's an AI, and we changed, because at the past we use some recording, like thank you for call Clínica Virgen de Guadalupe, whatever. But now you talk with somebody, AI, human, whatever, but you talk, and say, okay, I need to know, I don't know, information about your hours, or your working hours, or information about this specific set, and the AI refer the patient for the specific or the correct place. If you need information about the some specific exam, I don't know, the blood test, the AI refer this patient, okay, this test is for this, it provides some explanation, but transfer the call for some doctor's area or something like that. The AI is
in Spanish. All that in Spanish.
In Spanish and English, both. Because,
wow.
Okay, our clinic is La Virgen de Guadalupe, is a Hispanic clinic, but we have a lot of patients, that not speak Spanish. They only speak English, and we take care of this patient too, And the AI in the customer services, we implement the AI with the doctors directly, because when you stay with the doctor directly in the medical room, the AI is record, obviously under the
HIPAA.
And under HIPAA and under patient notification. If the patient agree, the AI record everything and create the medical note. And just with a couple clicks, the doctors change a little things, and that's it. It's a
let me ask
save
you,
time.
Dr. Reyes. So what would you say to those who keep saying that AI is going to take our jobs, right? Mm-hmm. Obviously, they're not impacting your business as much because you have 250 employees. But how do you manage that? What's your view?
All of this employee or
I mean,
how the AI? Okay.
AI taking on other.
Yeah, I think we did in our online university. We prepare some course with the AI because so many people lose the job, but some now all of these people need to adapt it. It needs to take information how because the AI. Okay, the AI is here. Everybody know, but you need to change your role. You need to know, okay, I use the AI like a tool for me. No.
Yeah.
Got you. So what I hear you say is embrace it because it's going to help me do my job better.
Correct.
And I can focus my time on more important things.
Correct.
More important
And
things.
you save time. And
I love it.
And you can to put this time that you save and provide better services and talk more with the patient, for example. You don't need to write a big medical note or medical record. You need to talk more with the patient. You need to listen more the patient,
That's amazing.
And
So
it proves of why he continues.
yes, exactly. Because I mean, he's constantly looking for ways to improve that patient experience and continue to deliver quality. This has been an incredible conversation. And I can't believe time, has run out for us. But we want to thank you for giving us the opportunity to take a peek into your amazing story. It's really filled with, learning moments and insights for us and for our audience. So really, really grateful to have you had here. And, you want to invite our audience to continue?
Absolutely. Listen to our podcast wherever you pick your podcast from, including YouTube. But I'm over here thinking, honestly, to be transparent, I'm thinking of what are my top 3 initiatives that I need to tackle. How do I prioritize them so I could continue to be successful like you? We really appreciate the time.
Thank you. I appreciate the invitation. Thank you. It's a good space for share our experience, for provide some history.
Yes. And we'll see you all at the C-Suite Power Play.
Very exciting.
Yeah. Thank you.